Respected Chairperson and delegates, there is no financial interest in my talk. First of all, why it is important? The wet lab is important because it is the building block of any surgeon's career. Whatever the skill we learn or we acquire from anybody, if we are doing it in wet lab, it will be much more faster. It helps us to attain some skill, develop hand-eye coordination as we all know, and apart from these two things, which is the most important, is it gives a chance to practice without any risk, or we can say it is a risk-free environment training in which there is no risk for the patient or even the whatever the changes or the mental changes anyone going to operate first on a live subject is very less when he or she has been trained under the wet lab. So in the setting of wet lab, four things is important. First is the space. Second is the requirement. Again, requirement depends upon two things. What are the consumables or the equipment required for that course, curriculum and cost. I will cover my talk only on these four parts. Space, basically what we suggest that in a wet lab, the space should be located in the main building of the medical college or the department so that the resident have access every time, because in the working hour most of the time residents are busy in OPD and another places, so they can do their wet lab practice in after the rounds in the evening or the early morning whenever is the required. And at least it should have a space for two people. One is for sitting, and if two or three residents are doing, or one trainer is there who can train them in a two places. This is the ideal size of the wet lab. Means if you go by 10 feet and 10 feet room, that is more than enough. You can see this is my setting of wet lab, and diagram is from my IOS skill transfer courses. Here we can have each and everything, a slit lamp, and if we wish to have a monitor for being another one, and two revolving stools are important because these tables cannot move up and down, so only we have option for moving up and down this stool and this microscope. And this is the original photograph which you have seen mostly in the IOS we are doing it. Here you have seen this is a simple changes. If anyone wish to change, this side will be the instructor and here will be the trainee who can easily do the wet lab in it. If space is not available to make cubicle for everywhere, if for a big conferences or anywhere, even we can have a continuous spacing, but we have to remember that there should be a spacing between two tables that they will not disturb each other. Now coming to the consumables. Consumables basically depend upon the two things. One is the nature and type of surgery. Another is the number of the person or the trainees in your department or anywhere. These are the simple consumables. Anyone, all of the teachers can guide which type of things is required for what. So I am leaving it. And these are the common materials used for the wet lab. All these are the photographs taken. This is, although it is very light, but here you have seen that these are the sutures placed on the thermocol. Even you can place on the banana, these eyes, and these are the nowadays wax eyes available in India for doing the phaco. Equipment, at least I suggest that one microscope, either new or old or anyone, it is table mounted or not table mounted. Nowadays many Ambala made companies also giving the microscope table mounted on the very low cost, and that will be used for training each and every institution. I am remember one thing important for these requirement is that if any place where we can have a thermocol box or ice cold box, because these goat size are very friable, so if we store them in a cold box, then it is built, it is having good corneal clarity for doing the surgeries. And another thing is, whatever the thing is available, at least we have some sink and tap near about that, because goat size are having higher risk of transmission of hepatitis C. So even the trainees and trainers should wear gloves, and we recommend regular washing of hands. This is the eye fixating device available for the phaco. Here you have seen these are the wax size used for the phaco, and we can also have a goat eye fixator also available. All these, this is, if no one is available, then we can simply fix the goat eye with the pin, and here you have seen this micropore for doing the surgeries. Nowadays we have with relation with there is no financial interest, but Madhu instrument make an vertical holding of this goat eye stands by which anyone can do a planation or the gonio. We are using it in the GSI conference. And there is a wet lab curriculum. This is the must. We design it, and whatever the wet lab expectation from the curriculum is that in the first year at least the student who are she is there, she is able, he or she able to put at least do some thermocol suturing on the wet lab. That is the most important step, and I hope all the seniors must go by with that. Suturing in the wet lab or thermocol anywhere somewhere in the gloves is the most important. So at least the first year I am for the first year wet lab training, the target should be the suturing, and the another for the second year whatever the wound constructions are there for the SICS or trab, anything should be done by in the second year. And at the end of third year, if he or she are interested in FACO, then at least know all the parameters required for the bottle height, vacuum, and this year. These are the three different curriculums for the wet lab for the first year, second year, and third year. Nowadays simulators are also available, but only drawback is they are very costly, nearly 2 to 4 crores costing for the both simulators. I am skipping this cost, but one thing I can say that most of the institutions or the teachers, when they met me, they said that wet lab is costly, but I am truly saying wet lab is not costly at all. There are many companies who are giving us an opportunity to buy the sterile free things, sterile free sutures, gloves, visco, everything, and that are the much more, almost 1/10 of the cost as compared to the sterilized sutures. So there is no need of buying whatever we are buying for the patient. For the wet lab, sterile free sutures and even the open gloves we are usually using it, it hardly costs much, uh, I think 1/10 of the cost of the original gloves. So by this we can do wet lab. These are the our articles in which we have demonstrated each and every points how to set up a wet lab in an institute, medical college, or anyone. If anyone interested, I will give it. With these regards, just only thing is have a proper planning and believe that this planning is by you all, means the mentors who can plan their wet lab for their own candidates. There is no issue of fund wet lab at all. Only thing required is the knowledge of the mentor and the willpower of the institution that they wish to do for their residents. Thank you, sir. Thank you.
Wet lab, and I really sincerely appreciate and I recognize your contribution to AIOS, especially PGTs and the skill transfer programs. Thank you very
sir.
much.
Thank you, sir.
So,
Any question?
any question? Any?
Sir, I want to ask a question to Dr. Krishna Prasad.
Sir,
Krishna Prasad is not there. He had some other
he had
commitments
some
in
another
other
kind.
session.
He's moderator.
He was
there.
a moderator in his other session, that's why.
Sir, I got a case where the different institute have different IL power for cataract case. So we planned for multifocal, toric multifocal. So what should we do if a different machine gives different IL power? So which one should be taken, whether IL master or?
So in our experience, what we do is we keep doing on one machine and then standardize our putting the IOL powers and then calculate and then see. Don't measure two instruments, different instruments which you are not aware of and then get confused. So the machine what you are doing, you have your post-op results on 100 patients with a similar eye, with a similar surgeon, and then with a similar, no complications, and then standardize that and then use them. So even if there is a difference with other scan, forget about it. The machine what you are using, what you are standardized, you need to do.